Hi, welcome to the instructional videos for your home test. The test we're going to go over today is the Genova CDSA 2.0. This is the stool test. This is over the course of 3 days. So we're going to go ahead and open this box and see what's inside. When you open the box, the first thing you're going to see are the directions and all of the requirements that are inside here. So we'll pull that out, set it down. There's a few bags in here because, as I said, this is over the course of 3 days. Day 1 and day 2 are exactly the same, and we'll get to that in a second. I'm just going to set these aside. And this is day 3. There's the pre-packaged FedEx bag that you're going to use to ship the whole box when you're done. And then on the bottom here are 3 collection devices, and we'll get into this on how to help collect the stool for the samples. So we'll set these aside. And then there's the requisition form we'll go over that's going to go back with the sample when you send it off to Genova. This is a random test. You can do this with any day, any time of day, whenever you need to go to collect. As we talked about, there's these collection devices. So these are the collection devices you're going to open. They have little tear lines. You're going to pull this open and place this on the toilet. There's 3 of them in each box, so you're going to use it for all 3 of your collection days. As you can see, the collection devices are going to help you collect the specimens. There's pictures here that show you how to put these devices on the toilet. As you see, you're going to place it down. There's little stickers on them. They're going to help stick to the toilet. And then you're going to place the toilet seat down. This is going to help you collect your specimen without contaminating it with the water. Day 1 and day 2 are exactly the same. They're just labeled day 1 and day 2. So you're going to use the glove to help you collect your sample. And in here, there's a red fill line here, and you'll notice that there is fluid in here. This fluid is a preservative that's going to help keep this stool viable while you transport. If you notice, when you take off the top, there's a little scooper that's going to help you collect to put your sample in the vial. It's important to remember that after you collect every single sample, they need to be refrigerated until you're ready to ship all of them. Once you have your sample, you're going to screw your top on tightly, and on the side it has your name. It says ID number, which you're going to use as your date of birth, the date, and the time you collected it. And then on the bottom, it actually wants to know the type of consistency your stool is, and you're going to mark which one it is on the bottom here. It says formed, soft, loose, or watery. After you collected the stool and you have a sufficient sample to the fill line, you're going to screw the top on tightly. You're going to take it and you're going to shake the bottle for 30 seconds. Once that is sample is completed, you can put it back in the bag, and this needs to be refrigerated until you're ready to send the rest of the shipments off. So as I said, day 1 and day 2 are exactly the same. And on day 3, there are multiple samples that we need to collect. You can do it in one shot if possible, or if you have to do this over the course of multiple bowel movements, you can do so. Again, there's a glove in here, just like the other 2 samples. In this case, there are 3 tubes, and they're all color-coded, and they all have a different solution in them. The important thing for collecting on these is, again, we need to collect to the fill line on all 3 of these, but the important thing is do not take stool from one bottle and put it in the next. You don't want to mix the formulas around, so you just have to be careful with that. Again, each one has a fill line. You're going to take this, collect the sample. You're going to do the exact same thing on this as the others. You're going to put your name, your date of birth, the time, and then the specimen consistency. for each one of these. Some of them the fluid's a little bit less, so you have to put more of a specimen in here to collect to the appropriate fill line. Once you have all 3 of these, there is one more for day 3, and it's just a complete specimen container by itself. I've actually marked, and I will always mark on here, there's a 40 milliliter line on the side, and then you just need a sample that gets to this line. As long as you have a sample in here, you're good to go. They also provide a stick to help you with that, which is here. So you can use this to help collect your sample to put inside this specimen cup. And then once that specimen cup is done, you can put your name, the collection time, and the collection date. And then these will all go back in the same bag that you pulled them from. And then all of these will go back in the box that it came with. Put these in there, and then our collections from day 1 and our collections from day 2 will go in there as well. And on here is all the information you need to fill out, the demographical information. This test does accept insurance, but we have to go over the insurance part. They accept most insurances. So I can help you with that insurance-wise. They do take certain types of insurance, but not all. I will go over that with you personally. Fill this out, and this goes back with the whole box. There's a little slot on the top here for that. And then once you have this whole set up, you're going to put it in the FedEx bag, and you need to take this to a FedEx location, not put it in a drop box. Please take it to a FedEx location where it won't sit in the heat. So take it in, they'll take care of it from there, and off it goes.